Hi, and thank you for joining us for On Call for All Kids, a weekly segment we have here at Johns Hopkins All Children's Hospital, where we're talking about timely topics in pediatric healthcare. And this week is World Breastfeeding Week, so we're talking everything about breastfeeding today. Here are your top 3 takeaways. The benefits of breastfeeding, common challenges moms face and options to help, and details on the Global Big Latch-On, an event that moms can attend. I'm Ashley Roberts, and I'm joined by Megan Howard. She is a lactation consultant here at our hospital. And Megan, it's so great to have you here.
Thank you. It's really good to be here.
So let's talk about World Breastfeeding Week. What is the purpose? What do we want the word to get out there during this time?
Well, World Breastfeeding Week really celebrates the global initiative that's going on for individuals and organizations that support and promote breastfeeding worldwide.
And we'll have an event here at Johns Hopkins All Children's. We'll get to that in just a little bit. But let's really get into what are the benefits of breastfeeding.
I could talk about this forever, but I'll try to keep it brief. Breast milk is really unique, what the mother makes specifically for her infant. It has all kinds of ingredients in every drop. It has live cells. It helps with immunity, prevents allergies. Babies that are breastfed for longer than 6 months have less ear infections, they have less respiratory infections. It helps later on in life with reduced incidence of obesity and diabetes, and there's benefits for mothers as well. It decreases the likelihood of breast cancer and ovarian cancer, again diabetes, and it helps her body heal after birth. Even helps her lose weight.
Yeah, it really is liquid gold. I know mom friends of mine, if it ever spills or something got left out too long, you're like, I lost that, because it is so vital, and it's amazing that women's bodies can produce this.
Yep.
What are some challenges that moms may face while breastfeeding too? Because I know there can be struggles with it as well.
For sure, absolutely. There's certainly can be supply issues, oversupply, undersupply. There can be issues with the way the baby latches. Every breast is different, every mouth is different, so sometimes there's a difficulty in the match up there, or difficulty with the baby actually removing milk from the breast and transferring it to the stomach. So there can be some problems, and it's very important to get help quickly, as soon as possible, because this is an event that takes place every 2 hours starting out. So if you're having any pain or infants having any struggles, really seek expert help right away.
And that's you, right? A lactation consultant is someone
Yes.
who has that expertise. If
Yes.
I'm a new mom, or even if you're a second time mom or third time,
Sure.
what should you do if you're having those struggles but you don't want to give up trying breastfeeding?
Absolutely. A lot of birth hospitals have lactation consultants on staff. There's also Women, Infant, and Children's as a free government resource, and they have breastfeeding hotlines that you can call and seek help as well. So there's a lot out there, and this is kind of what our World Breastfeeding Week is about, identifying those community resources that are out there for mothers.
What about milk supply? Any tips on increasing your milk supply if it's maybe not as much as you would like it to be?
Sure. It's a lot of hard work. But the main driving force is how frequently you remove milk. So the more often you remove your milk, the body gets the signal to replace that and make more. So a lot of times that has to do with frequency. And also the mom needs to remember to take care of herself. Make sure she's getting adequate nutrition and hydration and rest so that she's healthy and strong enough to be able to provide for her baby in that way.
Good tips. So we have the Global Big Latch-On coming up this week. What happens during that time? And we have it going on here at Johns Hopkins All Children's.
We do. We're really excited about it. It's going to be a fun time. There's a Tampa Bay Breastfeeding Task Force Facebook page that tells about all the events that happen in a 5-county area, so you can go online and check that out. But at Johns Hopkins, we are going to have an event. Moms can come. We'll have community support people here as well. They can come with their family, and community members can come out and support. And doors open at 9 o'clock. And at 10:30, the latch-on starts. And basically all around the world at the same time, moms will gather, they'll latch their babies on, and we'll count those numbers. And we'll have an event up here in the NICU as well for the moms to participate. They can be pumping at that time, kangaroo care, be doing hand hugs with their babies, whatever they can do depending on the stability of their infants at that time to be counted into those global numbers.
And what day is this?
This is on August 2nd.
Perfect. So if you're inpatient or your baby's inpatient, you can still participate. If not,
Yes.
it's going to be in our outpatient care center.
Yes.
Wonderful.
That's
Megan,
right.
thank you so much for all this great information
My pleasure.
about breastfeeding and World Breastfeeding Week. Maybe there's a topic you want us to cover. If so, just comment below on this video. We would love to hear from you. And you can also head over to our website. It's hopkinsallchildren's.org/newsroom. A lot of patient stories and other vital information there about pediatric healthcare. Thanks for watching. We'll see you next week.